Hi, everyone. Thank you for joining us for COVID-19 updates. This is a presentation that I personally am giving on behalf of Real Action Community Engagement. We asked a bunch of people to send in questions since with all of the new changes and variants, but also the new spikes in cases and outbreaks. And now that we've had some time to look at the vaccine taking effect, we're kind of wanted to provide a presentation where we could have some updates on what's going on. So I have used my resources as a biomedical engineer working at Harvard University to pull some data that may or may not be published for the public currently, and also talking to some of my friends who are medical doctors as well as working in the public health school here at Harvard to answer a lot of the questions that we sourced from you and that you provided. So thank you to everyone who did provide questions. We received a lot. And I've basically put together, we're going to aim for a 35 to 40 minutes presentation answering all of those questions. And then I will also be taking questions from the participants who are joining us live today. Oops. So first, I just want to give some quick background because I always try to do this so to enhance credibility, but also I think it's going to give a lot of information for the first topic that I'm going to cover. So I was educated at Case Western Reserve University for my bachelor's in science and my master's in science in biomedical engineering. And then I decided that I really liked doing research and I wanted to stay in academia. So I furthered my training by getting a PhD in biomedical engineering. So at this stage of my career, I learned how to do a lot of hands-on experiments in terms of working with mice, but also I do a lot of work with viruses and looking at healing. So I've learned a lot about inflammation and how the inflammatory system works and how viruses can affect that over the years. And now I've transitioned to my postdoctoral training, which basically means I've finished learning how to do a lot of the hands-on experimentation, and I've transitioned to the last part of my training where I will learn new techniques that I haven't learned previously, but also how to write grants and become an expert in my particular field, which in this case, I usually tell people that I'm looking at bone and teeth development, but also how when they're injured, they can adapt and repair and regenerate. And primarily right now, I'm studying how nerves in our face and our bones, our long bones, can actually help bone cells form new bone and repair areas. And then the ones for the teeth, I'm also looking at the nerves in the face and how stem cells in our teeth can also contribute with nerves to repairing and regenerating parts of your teeth. So I have right here a screenshot that shows my Google Scholar account. So if you are looking at articles that are published on the internet, you can actually go to Google Scholar and look up the people who are providing the quotes or the information in those articles. I'll also give a couple of other sites too for where you can check the credibility of people providing quotes. But here you can see some of my publications, which I'll also explain quickly the peer review process on the next slide. But you can also see how many other scientists have cited my papers, which adds credibility to the work that I've published. And I also highlighted two papers quickly, which you can access for free on the internet. But this one just shows how I've looked at fracture repair in the bones of mice. And actually, you have to study a lot of the inflammatory process, which is a similar response when you are infected with a virus and how your body responds to defeat that virus. And then the second paper I listed, I actually use viruses and other procedures to insert DNA into cells and see how they change. So because I've worked with these two projects, I actually have a very good understanding of inflammation and how viruses work in our body. And it also, know a lot about virus safety because in order to work with these viruses, we have to know how to handle them properly for these experiments. So these are based on the questions that we received on Facebook and Instagram, and then me personally from people. These are the concepts I'm going to cover initially. So first, finding credible sources. Then I'm going to do a quick summary of how the vaccines work. I'll also give you a link that you can look at our previous COVID-19 presentation where I went into depth on how the vaccines work. But today, in order to address some of the questions that were asked, we need a quick refresher to really understand my responses. Then one that's big is looking at how vaccines are compared to COVID-19 natural infection, because a lot of times people think if they've already received COVID-19, they have immunity sufficient that they don't need a vaccine, but this is untrue. And I'll cover why that is. Then I'm going to go through some common misconceptions from people. Like I've gotten a lot of questions about a lot of these topics. So I'll just very quickly go through whether they're true or false. Then we got some questions on the new vaccine boosters, as well as the virus variants, especially with the prevalence of the Delta variant. And then I want to talk a little bit more about public safety restrictions, because a lot of people have been asking me if I think we're headed for another lockdown. Also some known and unknown information, because I think there's a lot of misconceptions around what we do and what we don't know about the vaccines. And then also just some tips for how you can contribute to ending the pandemic at your own personal level. So first, just to keep going on the finding credible sources, I had hinted at this earlier when I went into my credibility, but I think it's really important that if you're looking at scientific studies, and if you're going to be quoting scientific studies, you have to be looking at peer-reviewed papers via PubMed. So the peer review process basically means that as a scientist, whenever I do a project and I collect a body of work, I submit that body of work to a publisher. The publisher has an editor who takes a look at it, determines if it's scientifically sound, and all of these people who do this are scientists, by the way, determines if it's scientifically sound, and then they will get 3 reviewers who are experts or at least very knowledgeable in the field to review my science and determine if it's worthy of publication. No paper has ever been accepted on the first try. You always get comments back from the reviewer on like, this science is a little sketchy, maybe you need to do this experiment or follow up with this, or double check how you did this and make sure it's correct. And then after you answer those responses to the reviewer, then potentially your paper gets published. But even then there's some more polishing with like your figures and the way you wrote the paper. So this peer review process, basically you're using your scientific peers to make sure that your science is correct and credible. So these papers that receive publication are the ones that are credible when it comes to looking at what does COVID-19 do, or sorry, how is COVID-19, spreading throughout the body, what the contagion level is, how the SARS-CoV-2 virus is operating, different treatments for patients and whether or not they're effective. These are the sorts of papers that you need to be citing, not just someone quoting potentially a scientific study or vaguely talking about science. There's also this new service called bioRxiv that a lot of scientists are putting their papers on this site prior to peer review publication in order to get feedback from scientists in the community. So a lot of times these bioRxiv papers are somewhat credible too, but really you need something that's published and is found on pubmed.gov. Also, the CDC website is now hosting the COVID-19 tracking project now that an administration change has taken place and they were able to actually do this tracking project correctly. I have advertised this previously in other presentations, but now just know that instead of having its own independent website, it is available within the CDC website. And the CDC website is also going to give you all of the correct information in terms of what is known and what isn't known about vaccines and the current virus outbreak. Also, if you aren't, I know these scientific things can be very, very heavy to read, and there's honestly no way that you're going to understand everything that's in a peer-reviewed paper. Even me as a scientist, I often have to look things up because the scientific papers are really dense now. But if you want a credible source for media content, I recommend National Public Radio. They also have a shortwave podcast, which is really nice if you're more of an auditory listener, and The Atlantic, which The Atlantic was actually the one who started the COVID-19 tracking project. These two media sources for me have been able to report the science most accurately. And I don't say that on a knock on media in general, but because of the way that our media is structured, they do want to try to get information out quickly, which doesn't always lead to the most accurate information. And then also because the science stuff is very dense and difficult to understand, there's some just genuinely accidental misinterpretation or portrayal of information sometimes. I'd already alluded to this earlier, but if you're looking through this media content and there's a quote that particularly stands out to you, and you want to see if that person really is an expert in their field and is giving reasonable advice, you can just Google their name on Google Scholar, ResearchGate, or PubMed, and you can look at their publications and their credibility and their, what they've actually contributed to, what sort of science they participate in. Because a lot of times, in order to get a quote, sometimes people will quote scientists or doctor or medical doctors, and they actually aren't an expert in that field. They might just work for a department where they kind of study some of this stuff. But this is a very quick way for you to actually check the credibility of your source. And lastly, ask a scientist. I know I'm going to go through a chart on the next page explaining why a scientist is probably the best person to ask right now, especially in terms of the COVID-19 things and vaccines, because the way that our career and the way that we do our work is structured, we're more adaptable to rapidly changing information and how to hold on to the information that is true and the information that is updated, as opposed to all of the other stuff that we've heard. But just to kind of break this down a little bit more, when it comes to certain topics, how do you know who is the expert? Do we trust a scientist? Do we trust a doctor or a nurse? Or do we look to a public health official as the primary source? So just to go over some of the key things that a lot of people have asked me about, we'll just start with this and I'll explain who you should talk to primarily, and then who also is in the mix and can provide some information. So vaccine safety and efficacy, at least for the COVID-19 vaccines, right now you need to be talking to a scientist, because they're going to be more up to date on the rapidly changing information. But also our doctors and nurses have been slammed with just trying to take care of people and keep them alive. So they literally do not have time to get the education and stay more up to date on all of the science and the rapidly changing information about the vaccines. What they do know is that they're safe and effective, so they know that they can safely administer them, and they will know when they should be administered, how to administer them, things like that. In terms of who should get the vaccine, that information is primarily held by the scientists, but then it's disseminated to the doctors and nurses so that they know when to apply it. And also a doctor and a nurse is going to be very, very good and probably better than a scientist for knowing when a person should or should not get the vaccine based on their individual health report. Scientists can give you general information as to who the vaccine can apply to, but a doctor and nurse is going to be able to look at your specific health plan and know the details. They're going to be able to help you make the best decision for you based on your personal health details. In terms of how to treat COVID-19, a doctor and nurse is going to be best for this because they're on the ground working with it and they've seen the patients. Sometimes scientists also interact with those patients because we do have a lot of clinical scientists, but also scientists are going to be collecting this information, and they're doing the studies on things like hydroxychloroquine when there was some concern with that versus the lupus drugs that were being used for it, but also looking at steroids. So the scientists can do the science to check on the treatments that doctors think are working. But for the most part, the doctors are the boots on the ground, and the nurses are going to know what's going on with that. And they look to the scientists to help them confirm their observations. In terms of the effects of COVID-19, the scientists are probably going to know that a lot better. Yes, the doctors and the public health officials are working with these people directly and seeing what's happening, but ultimately that can change based on their environment, their specific environment. So certain states that took it more seriously with different like vaccine mandates, mask mandates, and the lockdowns, a doctor and a public health official in those areas are going to have a different experience compared to a different region where their policies were different. And so the scientists, though, are able to collect all of this information and get a big picture of what's actually going on and what variables are changing how someone is responding to COVID-19. So those three people are all important for that, but the scientist has probably the best overall picture in that instance. Also, preventing virus spread. I put equally scientist and public health official for this because if you can remember in the early days of COVID, we weren't 100% sure if it was airborne, if it was on surfaces, like people were wiping off packages constantly. And then we were saying at first, okay, don't use masks because we need to save them for our health officials. And we weren't sure if cloth masks were going to work. But then we found that the scientists figured out that because of the size of the virus and how it's transmitted in these particles through your saliva and the air that you breathe, they were able to determine that masks are actually very effective for this, which informed public health officials. And then public health officials know laws and legislation and logistics that they can implement in the community to help prevent virus spread. And then doctors are going to get this information offhand and be able to use that to spread to their patients. So for virus spread, I would say equally scientists and public health officials. In terms of community safety, that also goes to a public health official, which because they're more familiar with logistics and what safeguards are put in place in order to help protect the community, also finances. But ultimately, all of that information is supplemented by what scientists are coming up with in terms of their research and looking at things. And also, one thing that can make this a little bit confusing is sometimes public health officials are researchers. There's not just, there's the hard sciences, but there's also the softer sciences where you look at policies and collect data on how policies and different safety guidelines have contributed to safety in general. So that's also a science in its own. So that's why I kind of put the scientist as a little bit smaller right there. And then in terms of hospital logistics, obviously public health officials and doctors are going to have a better idea of what's going on there because they're working with those things specifically. They also know more of the administration in those realms. But ultimately, I had mentioned that a lot of scientists are also clinicians. We have clinical scientists who literally work on study hospital administration and logistics. So they can also provide some insight to inform the doctors and nurses and public health officials. So given that overall summary, and I hope at this point I showed you how perhaps most of the time scientists are the best person to ask because they have this bigger picture idea of what's going on with all of these different facets of a pandemic. So given all of this information, how are scientists responding? In my experience, and I work in Boston, so I'm actually in a very dense research area. There's dozens of hospital systems and like multiple dozens of research companies and universities concentrated in a very small area. And all of these different organizations basically came together to have some blanket rules for how to protect our scientific community and also the hospitals from being overwhelmed. So from my experience, my lab actually shut down for about 3 months, other than we had a very small handful of essential employees who came in to take care of our animals and our cells and our different pieces of equipment that we would have lost like billions of dollars of research if we didn't have people coming in to take care of those. But then we shifted to shifts for work, and we had social distancing for several months. We've also done weekly testing since about June of 2020 when we did come back to the lab. And traveling was banned for a while, but I would say maybe once vaccines were available, travel was open again. But now we're still required to test more frequently before and after we've traveled. Also, I don't know if you can see me, but mask requirements are still in effect. I have to wear a mask every single day, all the time while I'm at work. And they still ask us to socially distance from our coworkers when possible. And we have equipment that only one person at a time can now use in order to maintain social distancing. It's also mandated that we all get our vaccines, and we're supposed to quarantine when we're sick. Also, there are very few in-person conferences happening right now. Basically, the scientific community has been on hold in terms of coming together to meet to discuss science. So it's kind of put a pause on science and collaboration in general, but some conferences are slowly allowing for people to attend in person, but it's all socially distanced, masks are required, and vaccination is now going to be required, or at least a negative COVID test within 24 hours of attending the conference. But this just kind of goes to show you how scientists are responding. And in my building in general, we haven't had a single positive case, but also we've still had pretty normal lives and work days. So I think these small sacrifices ultimately were very well accepted by the community, probably because of our understanding of how serious this is and how the virus can affect a work environment. So I just kind of wanted to share this with, if you look at a group of people who have probably the best understanding of what's going on right now, what they're doing to protect themselves and respond to the virus, I think is an important insight for people. So just to quickly go over the vaccine summary, I wanted to just talk about how a virus actually infects the body so we know the mechanism, what the vaccine does to prevent this, and then I'm going to go over some really important points that come out of me describing this basic information, because we're going to need this knowledge moving forward for me answering some of the questions. So just general virus activity. Basically, it enters your body and it infects the cells inside of your body. And so that's where we talked about the mRNA and the previous presentation I gave. This is where the mRNA comes into play, because the virus basically gives the instructions via mRNA for our own cells to produce more of the virus. And they use that mRNA as instructions to produce more of the virus, but also allow the virus to attack our tissues in different parts of the body. So the virus will, I think this word is good, hijack our cells in our body to amplify and spread throughout the body. And then we have to wait for our immune system to recognize that the virus is in our body and attack the virus and get rid of it. So this is important because the amount of virus that is in your body, and basically your body's ability to see the virus, these two factors really give light to how sick you're going to get and how you're going to recover, and also how well a vaccine is going to work for you. So let's cover again how the vaccine works. So I did the mRNA one specifically because the Johnson & Johnson one is a more traditional one, which uses DNA, but they're very similar concepts for what we're going to cover here. But for the mRNA, the mRNA enters the cell. So you're basically skipping the part where the virus injects itself into one of your cells. And instead, you're just getting the instructions from the cell. So your body thinks you're sick, but you're not actually sick. And then what your body does is it starts to have this immune response. So it produces cells that will start to attack the virus. And those cells also produce antibodies, which help attack the cells. But then some of those antibodies stay around in case more of the virus comes back later. And so a lot of people are, if you look at the PCR test, which tells you if you have virus in your body, a lot of people have also been talking about antibody tests, because the antibody test can tell you if you've ever been sick, because some of these antibodies hang around just in case the virus comes back. But what people aren't really talking too much about is the presence of memory cells. So these cells actually are produced in your body and stay long term, so that if the virus comes back later, these cells can make sure that you have a response right away, because the antibodies don't stay in your body forever. You have a certain high level after you've been affected, because your body is thinking, okay, I just went through a lot. I'm going to keep some of these antibodies around, because as soon as the virus comes back, I can make sure the antibodies are there to destroy the virus right away. Well, over time, if your body isn't being infected with more virus, those antibodies will go away because your body thinks you don't need them. So what it does then is it also creates these memory cells, and the memory cells reside very long term and they stay in your body. And if the virus comes back in, then the memory cells can make sure that antibodies are produced quickly to attack the virus. So why am I telling you this? Quickly to go over so different tests. I call these determinants because I think there's certain parts in your body where if you look at this, this is what it tells you. Like if you have virus in your body, this determines if you are infected at all. So if you get a SARS-CoV-2 test, it will tell you if you've been infected. If you get an antibody test, it will tell you if you had been infected at one point in time by a virus, but it also tells you if you have short-term immunity. And so for people who are naturally infected by the SARS-CoV-2 and develop COVID-19, they have short-term immunity for about 90 days. Because for 90 days, you have these antibodies floating around waiting just in case the virus comes back. The memory cells will let you know if you have long-term immunity. This is really difficult to test for because you don't have a lot of them, because they kind of just sit there. And then once they're activated, they will grow and respond. So this is important because with a lot of people who are naturally infected by COVID-19 or SARS-CoV-2 and develop COVID-19, they don't necessarily generate memory cells. But with multiple doses of a vaccine, you can generate memory cells. So this indicates that the vaccine has better long-term immunity. So a couple more takeaways from this general summary I've given you. The amount of virus in your body is the biggest factor in determining illness and recovery. So one of the reasons why masks are so important is because if you wear a mask, you get fewer droplets that can transmit from one person to you, which means there's not as much virus entering your body from the beginning. So if you have a very small amount of virus enter your body, that means your body has more time to produce those cells and those antibodies that can come and attack it. If you get a lot of virus to begin with, it's more likely that the rate at which the virus can multiply and build up in your body is going to be much faster than the rate at which your cells, your immune cells, and your antibodies can build up to attack the virus. So imagine it as like a war where on one side of the war, maybe you have like 10,000 soldiers, and on another side, you have 100,000 soldiers. It's a lot harder for the side with the 10,000 soldiers to overcome the 100,000. So think of a mask as a way of trying to make sure you have your body's side of the war is more equal footing with the virus's side of the war, because it's making the number of soldiers basically smaller. So the amount of the virus in your body determines how sick you get based on what I just explained, but also how contagious you are. Because if you have a lot more virus in your body, you're transferring more virus through your spit, and you can give more virus to someone. But also if you're wearing a mask, that helps a lot too. And then the amount of virus in your body will also determine if and how quickly you recover. Because if you have too much of the virus to begin with, those are the people who get very, very sick. And also people who don't have great immune systems. They can't tackle that amount of virus very quickly. So this brings me to the next point, which means the natural immune response is diminished in elderly, typically children, and also the immunocompromised. So this knowledge helps us explain why certain populations are at risk for either infection by SARS-CoV-2, but also honestly the vaccine, because there are some people who are so immunocompromised that any sort of introduction of a foreign thing can actually cause them to get sick and die. Because it's not, immunocompromised doesn't necessarily just mean that you have a very low acting immune system. In some cases, there are diseases where people have immune systems that will attack their own cells. They will attack the healthy cells and will attack their own body. So just introducing something into their system can actually really hurt them. And this is the group of people who they can't get vaccines, because just the process of the vaccine itself can actually really hurt them. And that's why it's really important for other people to get the vaccines and wear masks, so that we don't infect the immunocompromised people who have no option to even get a vaccine. And I've also talked about this several times, but masks protect us because they minimize the amount of virus that is initially spread and introduced to us. So just a quick summary too, the vaccines protect us because first they decrease the amount of virus in your body, because essentially vaccines prime your body to attack the virus immediately, because they have the memory cells on hold. And also in some cases, they lengthen the amount of time that antibodies are circulating throughout your system. So because they do this, they decrease the amount of virus that's in your body. So it's very easy for your natural immune system to attack it, but also they increase the speed at which your body can destroy the virus. So increase the speed of your cells and decrease the amount, the speed at which the virus can replicate. Also, I think this is super, super important that viruses, I had mentioned earlier, like at first we weren't sure if viruses could survive on surfaces and things. In the case of SARS-CoV-2, it needs a host to survive, which means the longer the virus is inside of your body, the longer it has to mutate. So if you have a vaccine and it's decreasing the amount of time that the virus is in your body, it's also decreasing the amount of time it has to mutate. And we'll get into that a little bit later. So I had a lot of people ask me to compare the vaccine versus natural infection. And one thing that I had already talked about was the short-term versus long-term immunity. So I put together a quick chart. A lot of this is all based on my personal judgment, based on the scientific papers I'm reading and the case studies, and looking at what the vaccine does versus what natural infection does. So for short-term immunity, it's guaranteed for the vaccine that you have at least 90 days of protection. And that's even with just the first shot. So if you get the second shot, it's even longer. In the case of Johnson & Johnson, it's longer just with the first shot. For COVID-19, you're almost guaranteed. I honestly should have put it right here, but there have been several instances of someone getting reinfected with SARS-CoV-2 within 90 days after having it. So I'd say highly likely. Also, in terms of long-term immunity, because I just talked about how vaccines help with the creation of memory cells, that it's also highly likely that you have long-term immunity. And there's also been several reports coming out that have shown that the vaccines have had a very long-term effect. When people ask me how long the vaccines are effective, we can't say, because it would be like if I went to the grocery store and I bought a piece of fruit, and just having that fruit after 2 days, someone asked me how long that piece of fruit was going to last. You literally have to wait the whole time until the piece of fruit gets bad to really know how long it's been effective. So in the case of these, it could be something like a vaccine where you get it one time and you're done. It could be like the tetanus shot where you have to get it every 10 years for it to be effective. It could be something like the flu shot that we have to give every year. The data that's coming out right now suggests that it is effective at least for the year. But when we talk about the booster shots, I'll get into that a little bit more later. But for now, what you need to know is because the vaccine has a lot of evidence showing that it results in production of these memory cells, it's highly likely that there's going to be very long-term immunity. But with natural infection from COVID-19, you're really only guaranteed those 90 days. For people who've developed a very severe illness, and so their body's probably a little bit more freaked out in terms of, I need to have more antibodies around because this virus was really terrible. It took my body a long time to fight it off. In those cases, people might also create memory cells, because if the illness was so severe, it's likely that your body is going to say, hey, this can't happen again. I'm going to build the memory cells and the antibodies to make sure. But even for people who had it very badly, it's still good to get the vaccine to guarantee that you're getting those memory cells. And there's some evidence coming out that you really only need one shot. But again, until there's been proper studies for that, just get both of the shots if it's the mRNA vaccine. In terms of contagion, oops, I forgot to put the one for this, but contagion is guaranteed for natural infection. I don't think I had to mention that, but it's not likely for vaccinated, because if you're vaccinated, you can get rid of the virus very quickly. And if you're vaccinated and wearing a mask, it's probably near zero that you can actually give it to someone else. But it is important to note that if you are vaccinated, you can still technically carry the virus and infect someone else. So for parents especially, even though you're vaccinated, it's still, there's going to be an extra level of precaution if your kids aren't vaccinated yet. In terms of death and hospitalization, that's near zero. for the vaccine. I do want to address, some people have asked me about the deaths associated with vaccines. This is difficult because the deaths that have been reported are either from the AstraZeneca vaccine, which we don't do in the US, that was in Europe. There's a reason why AstraZeneca was not approved even for emergency authorization in the US. The women who died from the blood clots for the Johnson and Johnson, it's undetermined because the doctors gave them heparin, which the heparin might have been what actually killed them. And then also, if you look at the vaccine adverse event reporting system known as VAERS, also there's been all of the deaths that have been reported for that, none of them could actually be directly connected with the vaccine. A lot of them are someone who got the vaccine and then it was an elderly person and then they passed away from natural causes, or it was like someone who got the vaccine and but didn't get it soon enough and they got COVID right after and died from COVID. Because I do know someone who got their vaccine and they developed full-on COVID 3 days later because they didn't socially distance or get a test done before they went to get their vaccine, and they came into contact with someone who had it. And then instead of the vaccine helping them prevent getting infected with COVID, it actually amplified their symptoms. So I can't tell you with any certainty that someone has actually died from the vaccine. And even all of those reports I just mentioned, there's still, I mean, those are only dozens of cases as opposed to the like 30 million people who have been vaccinated without any problems. And even then with the J&J, we had the pause and they studied it, they corrected it, and we haven't had any problems since then. So I think if anything, it's unfortunate that those happen, but it also shows that the scientific process works. So moving on to severe illness, especially in the case of the Delta variant, it's highly likely this time because this variant is really savage. But again, with death, hospitalization, severe illness, and long-term health effects, it really depends on the individual person. And because this virus is it's more of a blood disease, and because it affects people so differently, it's kind of hard to put these four anywhere with certainty for every single person. But I can tell you in comparison to the vaccine where it's nearly zero, this is basically where natural infection falls in comparison to the vaccine. So all you really need to do, take away from this, is that the vaccine significantly reduces your chances of having a very severe reaction to the SARS-CoV-2. But also, I put this disclaimer here that it's going to differ for immunocompromised people, which we'll get into a little bit with the boosters, and then also with these new variants. So far, the vaccines are working very well for the new variants, but it's early, and if more people don't get vaccinated, so allowing for new mutations to occur, this could become a problem. So these are just some common misconceptions that I wanted to clear up based on questions I got from people. So it's important to note all of these statements are incorrect, and I'm going to explain why. So the first one is only people with pre-existing health conditions, the elderly, et cetera, get severe COVID-19. Even professional athletes or like personal trainers who are in their 20s and 30s have gotten very severe COVID and died from it. If there's one thing we know about this, it's that it's extremely unpredictable and it takes no prisoners, basically. That said, with the Delta variant, children, initially this could have been true, but children do not typically get COVID-19. That is not the case with the Delta variant. It is actually very savagely ripping through children, and we've had, unfortunately, a lot of children die in the last month or so. If you've had COVID-19, you do not need a vaccine. Again, this isn't true. I basically just delve into that, why you need memory cells, which are very important for long-term immunity. So that's why your vaccine is important. The vaccine can give you COVID-19. This isn't true because the vaccine carries not an actual virus. It carries the instructions or the mRNA that I explained earlier. It just carries the instructions that make your immune cells triggered and respond to something. So they think a virus is there, but there actually isn't a virus. So it just scares your immune system enough into thinking like, okay, I have to make sure I have these memory cells and these antibodies ready to go if I get the real virus. The vaccine can alter your DNA and fertility. This isn't true. It can't, there's actually, so the virus can actually alter your DNA. I use viruses to alter DNA on a daily basis for my research because they can actually get into the structure and mess around with it. But fake DNA constructs and mRNA operates at a different level than DNA, so it can't touch your DNA at all. And then like the J&J virus, which uses a fake DNA construct, that's not going to alter your DNA either because none of it gets into your actual DNA, but a virus can. So for people who have concerns about DNA and fertility, they should be more concerned about the virus because that's going to have long-term lasting effects. One thing I should mention too, people who have had especially more severe cases of COVID, they're actually been finding the virus hiding in your body. So similar to people who get chicken pox, and then it resides within your body for a long time, and you can actually get shingles later on in life if that virus is activated. This is the same thing that's going on with this virus. So you're at risk for long-term effects. And there's also some evidence coming out that getting a vaccine can eradicate some of that virus hiding within your body because it stimulates this very real immune response, but in a fake way. It actually triggers your immune system to get rid of the virus that's hiding in other places. So if you've had COVID-19, that's also another reason to get your vaccine. In terms of fertility, I don't even know where this came from because the origin of your cells and your eggs and your sperm is completely different from the origin of your immune cells and things. So I actually don't, I don't even think I can respond to that because from a scientific standpoint, there's no way that a virus that triggers your immune system can have anything to do with your production of eggs or sperm. So if anyone has information on where that's coming from and can send that to me, that would be helpful because then maybe I can address it a little bit better. We don't know the long-term effects of the vaccine. If you look at our previous presentation, Jen actually did a really, really good job with this, explaining how like 95% of the effects of the vaccine are allergic reactions, which you notice within like 15 minutes of getting the vaccine. So for everyone who's got them, that's why they make you sit and wait in observation for 15 to 30 minutes so they can see if you have an allergic reaction to it. But the vaccine basically just comes in, induces an inflammatory response, and then it's gone. So there would be no long-term effects of the vaccine because it doesn't alter your DNA, it doesn't alter your fertility, it doesn't stay within your system because it's eradicated by your immune response. So we actually do know the long-term effects of the vaccine and there are none. The vaccine was rushed. Jen also did a really good job explaining this in the previous presentation, so you can reference that. But to summarize it quickly, a lot of money. So I think I should say, first of all, the mRNA technology has been around for decades. It actually was, it came to fruition at Harvard. And the researcher who came up with it started his own company, Moderna. And they've been working on this for a very long time, but they couldn't get it to market because they couldn't get enough funding and volunteers to actually do it. Because everyone was like, well, if traditional DNA vaccines are working, why would we do this? But because of the pandemic, resources were diverted for production, money was diverted for production, and volunteers were lining up out the door. So because all of these things came together at the same time, the vaccine actually followed all of the safety procedures that it normally would. It just happened a lot faster because things were happening simultaneously and we made it a priority. So I always like to say the vaccine was prioritized, it wasn't rushed. Also, we don't know what's in the vaccine. You can actually look up the ingredients of the vaccine. It's something like salt water, and then the lipids that whatever carry the actual mRNA, and then it's in the mRNA. But I work with mRNA all the time. It's not going to hurt you. But you can actually look up a list of what's in there. And if anyone wants me to explain anything that's in it, I'm happy to do that too. Also, at least for the mRNA ones, they don't contain any egg products. And I know sometimes if there's egg product, like egg product is used as a stabilizer in vaccines, and people will have an allergic reaction to that. But for the case of the mRNA, that was not needed. So there's also actually a decreased risk of an allergic reaction with the mRNA. This one too, I have a hard time with this one. With the effects of COVID-19 are best measured by the death toll. Because for me, In my opinion, I think we knew that a lot of people were going to unfortunately pass away from this, but the long-term health effects that are coming out of this from natural infection and development of COVID-19 are much more problematic, in my opinion. And also, hospitals being overwhelmed is probably a better measure of how bad the pandemic is. Because if hospitals are overwhelmed, it means we can't take care of people for COVID-19, but also for other illnesses. Because there's actually a lot of reports of people who would go to the ER or and not be able to receive treatment in time because they're swamped with people who have COVID. Similarly, I actually know someone who passed away from cardiac arrest because they were so scared of COVID going to the hospital that they didn't want to go to the ER for their heart attack and they ended up passing away. So, in my opinion, you want to look at how overwhelmed your local hospitals are and, the long-term effects of this illness and how people are coping afterwards are also two very, very important measurements. And one thing that our country in general just isn't necessarily great about is also looking at the mental and emotional effects of all of this happening, which I think we'll have a better idea of in the coming years when we've had more time to process this after dealing with the immediate demands. So for the booster, I just wanted to quickly talk about I know they're throwing around booster, but the more important thing right now is that people categorized as high risk need to get a third shot to be fully immune. So this actually isn't even considered a booster for this population. If you look at the hospitalizations, like a lot of people are putting out statistics on, oh, look at vaccinated versus unvaccinated in the hospital. And they're like, oh, people who are vaccinated are still having to go to the hospital. So that means the vaccines aren't working. What's actually happening is you're getting a lot of high risk or immunocompromised people who were vaccinated, but have to go to the hospital because 2 shots wasn't sufficient for that population. So this means people with cancer, organ or stem cell transplant recipients who are taking medication that actively suppresses their immune system, similar people who have diseases where they have a natural immunodeficiency, advanced or untreated HIV infection. So again, you have a virus and your immune system's compromised, and also treatment with high dose steroids or other drugs that suppress your immune system. So what the reason why people are in the hospital who have been vaccinated is because they already have compromised immune systems. And we're learning now that they need a third shot to be fully immune because they're, like if we go back to the army analogy, they need more help getting more soldiers on their natural immune system army. They just have a very, very low number to begin with. But that being said, the people who have been vaccinated and are ending up in the hospital are still doing a lot better in terms of recovering than people who are just getting infected with COVID and who aren't vaccinated. So for those groups, it's not actually a booster. It's just a third shot to be fully immune. But there's also stuff coming out saying that certain populations, if you've got the mRNA vaccine especially, it's recommended that you get a booster about 8 months after you've finished your regimen. So while I say it's currently unsure if boosters are needed, some employers are recommending them. So I have friends who work in nursing homes and hospitals. Their employers are saying, can you just get it to be safe? But really, like going back to the fruit analogy where you have to really let the fruit sit and rot to figure out how long it takes. We still need to do that. So, and the only thing we can do is just let time happen. So until we can let time just happen to get some real data, if you are in a line of work where you have to work at on site, you're in like customer service or in the service industry or working with children or elderly, you really should just get a booster. And it's perfectly safe, even if you don't necessarily need it, it's gonna be perfectly safe to get it. You just might, have another minor immune response. But I would just recommend try to get the same brand. And it doesn't have anything to do with safety. It's just getting the same brand, you know what your potential side effects are gonna be. So you have a better idea of what to expect when you get that. So I just recommend getting the same brand. In terms of the variants, I've already kind of talked about the Delta variant, but the reason why it's so problematic is that the virus multiplies much more rapidly. So imagine like their side of the war, they can produce soldiers much more quickly to try to fight your soldiers. So this means it's significantly more contagious because you need a smaller amount of virus to initially be introduced to get a bigger level of virus in your body. This also means the disease is more severe and it progresses faster, and it's more likely to result in death. So doctors and nurses are reporting that people are getting much sicker, much faster, and they're dying a lot faster without them being able to do anything. This also means that it's affecting previously low risk populations, especially children and vaccinated people. So it's possible that the population I mentioned earlier, with if you're immunocompromised or taking drugs that are suppressing your immune system, it's possible that the vaccine would have been sufficient before the Delta variant arrived. But because the Delta variant can multiply very quickly, this means that for someone who's immunocompromised, they aren't able to attack it as rapidly because their body just doesn't produce it at the speed that is needed to take it down. So I also really wanted to emphasize that variants, I touched upon this a little bit earlier, but variants arise from continued infection of the population. The virus can't just sit on a table and mutate on its own. The way that the virus mutates is that it enters your body. It can get into your DNA, but it can also make changes to its own DNA while it's attaching to your cells. So, and then these mutations result in a new strain, which means change in RNA and virus behavior, which typically means that it's more contagious and it can rapidly divide. So if you are not vaccinated, you're actually contributing to the generation of more variants being produced. Because if you're vaccinated, you cut down on the time that the virus can be within your body because you defeat it quicker, and also, which also means the amount of virus in your body is much smaller. So being vaccinated is actually a big deal in terms of preventing new variants from arising. And I know that these vaccines right now are working very well for the variants, but as a scientist, one of my main concerns is that if we don't get enough people vaccinated right now, and even if they don't get really sick from COVID, the fact that the virus can stay within their body for a longer amount of time gives it more opportunity to mutate, and then new strains are produced. So getting vaccinated is actually super important for preventing new variants from coming out. And if new variants come out that the vaccines no longer apply to, we basically we're basically back to the beginning. So I really want to emphasize that vaccination is very important, even if you're not that concerned about protecting yourself, and you're willing to deal with the consequences. You have to really consider the long-term ramifications of your decision and how you are effectively, participating in part of the problem. So I had a lot of questions about lockdowns and restrictions. Do I think lockdowns are going to happen? What restrictions are going to happen? It really depends on state by state, which we've seen. But I can tell you what the lockdowns and restrictions are subject to is the vaccination rate. So for example, in my state, I live in Massachusetts, we actually have a very good vaccination rate. So we're not too worried about any lockdowns. We did recently have an indoor mask mandate restored, but that hasn't really been an issue at all. Also, how overwhelmed the hospitals are. If your hospitals can't take care of people and they're having to turn away people who don't even have COVID and they're dying, then a lockdown might be needed. Also, development of new variants. If another variant comes out and the vaccines aren't useful anymore, we're going to have another lockdown. And then also certain government officials, they're just going to make the decisions that they're going to make. But some government officials might be more keen to enforce restrictions or lockdowns compared to others. So you really have to take all of these into consideration. I also get a lot of questions about why is the service industry such a mess right now? Because I think a lot of people thought at first the service industry was lacking because people were collecting unemployment. So it was easier to collect unemployment than go back to work. But we've seen that with employment being ended, this just isn't the case. And so actually talking to a lot of people in the service industry and also scientists, a lot of people aren't returning to the industry because they're very concerned over exposure to COVID-19, especially if you're working in something like a restaurant where people don't have to wear masks while they're eating. And like, who knows if they've been vaccinated or how seriously they're taking it. So, and also healthcare workers, like just being exposed to people who decided for personal reasons not to protect themselves or other people. So a lot of them aren't returning over fear of that, but also because of the lockdown, a lot of people understood that, it's a career where you can have a lot of financial instability. So they've diverted into other careers. A lot of people have gone back to school. Also, honestly, a lot of the consumers have just been rude and making that work life miserable for people. And I get it because everyone's frustrated and tired of this, but that doesn't mean you need to take it out on your server. And so a lot of people have been quitting for that reason as well. Also, a very lesser known thing that I actually know a few lawyers, and just working in academia, I work with a lot of people from other countries, and they use visas to come over here to get their own training or work in hospitals or conduct research. And there's actually a lot of the visa restrictions that were imposed by the previous administration, so the Trump administration, made it so that we can't get temporary work here that is pretty standard otherwise. But also COVID has made it so a lot of people can't travel from other countries. So I was actually just in Alaska in Denali National Park, and one of the restaurant owners, like everywhere, was struggling. They usually get a lot of seasonal work off of J1 visas, and they couldn't do it this year because of the visa restrictions by administration. And then Cape Cod, which is a vacation area, part of Massachusetts, they typically get a lot of seasonal work from the Dominican Republic. And because of COVID restrictions, they weren't able to have those people travel here this year. So I think it just goes to show how, like, even with legal visas being in place, the pandemic, but also our administration making maybe not the smartest decisions about visa restrictions, can really hurt our economy in general, and also just like our workforce. I think it's also important too to point out that we've lost, over 600,000 people to COVID, and a lot of them came from the service industry because they were on the front lines. You got a lot of healthcare workers, people working in restaurants, delivering packages. A lot of those people died because they were at the front lines. So I would just really emphasize and encourage people to be very kind, and also, be patient, because it's taking them a lot longer to maybe bring your drink to the table. But at the end of the day, like, they're actually they're risking a lot to provide you with this service. So maybe just think of all of these things before you snap at your server. Also, a lot of people have asked me, like, oh, is it constitutional? Is it appropriate for places of employment to mandate that you get a vaccine? And yes, first of all, there's like a Supreme Court case that allows for this. This is actually a legal thing. It has nothing to do with the Constitution. I don't know why people are bringing that up at all. But also, now that FDA approval has been given for the Pfizer vaccine, it is definitely allowable for employers and public spaces to mandate vaccination, because now that it's FDA approved and we know that it's safe and effective, it's within the full realm that it can be mandated. So I think everyone should expect that to be coming, big waves of mandates coming through. And like I said in the beginning, Harvard mandated that we had to get it like sometime in July. So a lot of places have already been doing this. Oh yeah, sorry. One last thing I wanted to mention is that in conversations with people, lockdowns are still better than forcing these businesses to cope on their own. I know a lot of people complained about how lockdowns like hurt the economy and people's businesses couldn't stay open. But if you think about, like, even looking at children going back to school right now, how terrible it's been with having, like, kids can't go into classrooms because they might have come into contact with someone. If you can envision these businesses, if we didn't have a lockdown, but these businesses still had to stay open, and people were getting sick at those places of businesses, which allows for lawsuits because they were getting sick and not being taken care of. But also, like, if you have a restaurant and a server gets sick and they can't come to work, then your business is still struggling because you don't have the staff to come in and actually do their job. So it was literally between, the government saying, okay, we're locked down. Everyone just kind of has to cope with this together and get through it. And we'll have at least some small business loans or something, as opposed to letting things stay open. And then the businesses have to cope with all of those problems on their own, and like still probably shutting down because they don't have staff to actually do their jobs. So, I mean, it's not a great situation. I don't think anyone ever wants to do a lockdown, but try to think of it in the bigger picture of, it's better to protect people's health, and all of the businesses kind of have to deal with it together, as opposed to businesses are literally just hung out to dry and on their own, and people don't want to go to that business or work for that business because they're at risk. So just keep that into consideration if another lockdown does happen. So just very quickly, some of the what is known versus what is unknown with COVID-19 and the vaccines. COVID-19 natural infection can result in long-term health problems. I covered that already. And these long-term health problems can include like developing an immune disorder. I actually do know someone who developed a pretty bad immune disorder, even though he had pretty mild COVID. Like wasn't even sick that long, and this is a younger person. But also a lot of people are dying from organ failure months after having gotten COVID. And a lot of people are having more issues with pain management, arthritis. There's a lot of people still haven't gotten their sense of smell or taste back. So a lot of problems can actually result. And we still don't even know the full range of the long-term health problems. Also, COVID-19 natural infection does not guarantee long-term immunity. I talked about how it doesn't necessarily create memory cells. You need the vaccine for that. Vaccines are safe and effective in people ages 12 and up, and this includes pregnant women, which they have all the data they need on that right now. I spoke with a friend of mine who's an OBGYN. He highly recommends that all of his patients get it because especially he's seen some of the real disasters of pregnant women coming in with having COVID, and then the baby has COVID. It's really awful. And a lot of women lately with the Delta variant have been delivering their children and then passing away from COVID and delivery complications. So I really encourage pregnant women, now that the data is out there, that they also get their vaccine. One thing that's interesting too is it's very possible that if you're pregnant, you can actually pass on your antibodies to your child, especially while you're nursing. So we're still waiting on more data for that to come out, but it's very possible that if you're pregnant and you get the vaccine, you can actually help protect your baby as well, just by transferring your immunity to the baby. So high vaccination rate plus mask usage plus social distancing are needed to get this under control. High vaccination rate probably would solve all of it alone, but you need mask usage and social distancing also to protect the vulnerable populations and keep the spread down, because we know that people who are vaccinated, especially with these new variants, they technically can still carry. So a three-pronged approach is what's ultimately needed to get everything under control. And I've touched upon this, but the virus affects everyone so differently. It's pretty much impossible to predict illness, especially with this new Delta variant. So, and because it's more of a blood disease than a respiratory disease, that also introduces a lot of variability. So like I said, it takes no prisoners. No one's really safe from this. And I also wanted to emphasize that I know a lot of people have been complaining about their side effects, especially if you're someone who got like pretty bad side effects from the vaccine. But what I always remind people is that the vaccine gives you basically a snapshot of what your illness could have been. And it's really important to remember that with the vaccine, it's not a genuine illness. You're just experiencing side effects, and it will go away in a short amount of time. But, you know, my sister who got it, she was a nurse in Seattle when COVID first hit, and she watched a lot of patients suffer and pass away from this. And when she got the vaccine, she like got very severe nausea and like had chills. She had pretty bad symptoms, but she said She's like, I would still rather have a fake illness that, was awful for a couple days than go through what I watched my patients go through. And I think too, a lot of my friends I've talked to, they're like, my symptoms were so bad from the vaccine that I'm actually very thankful I didn't get COVID, because who knows how awful it could have been. So I get it. If you're going to get symptoms, it's not fun, but at the same time, it's still much, much better than getting full blown COVID. And actually, in a lot of cases, has made people thankful that they got the vaccine and didn't get COVID. So things that are unknown: how COVID-19 develops. We still don't really know the mechanism of how this virus causes these diseases. We also don't really know how the virus works, how it multiplies so quickly, how it's mutating. We still don't, there's no treatment for COVID-19. There were some preliminary studies with steroids that proved to be somewhat effective, but in a lot of cases, those steroids were actually terrible too, because they suppressed your immune system. So there's still no treatment for COVID-19. We also don't know the full impact of COVID-19 effects on our long-term health. We also don't know if the vaccines will protect against future variants. So it's really important to get the vaccine now so we prevent future variants. We also don't know how long the vaccine is effective. Like I said, we have to let the fruit fully rot till we know. Also, this is very interesting, why the vaccine temporarily affects women's menstrual cycles. So if anyone is interested in reporting their menstrual cycle symptoms, there's a researcher at University of Illinois who's collecting all of this data so they can assess it. But they really think that because this is more of a blood disease, it's possible that that's why it's temporarily affecting their menstrual cycles. But again, that should last for maybe a month or two, and then it should be back to normal. And then we don't actually know, I went over this earlier, we don't actually know if anyone has died from the vaccine, at least the ones that are approved in the United States. So just some quick tips for contributing to ending the pandemic that we can all do individually and we can help our healthcare workers and the scientists trying to tackle this. In case you didn't know, I'm very pro vaccination. So the sooner you can get vaccinated, seriously, the better. As I've hopefully gotten that point across with the variants, but also you're protecting yourself, people who are not eligible for the vaccine, specifically immunocompromised, and children. With the Delta variant, I'm very nervous for children right now. And the children don't have the choice. They cannot protect themselves. So if they're under 12, they definitely can't protect themselves right now, because still working on the trials for the vaccines, which should hopefully come around for December by the end of the year. But we have a responsibility to take care of our children because they can't take care of themselves. So it's so important that especially if you have children or you work with children, you interact with children on any level, that you're vaccinated and you're doing everything possible to protect them. Also, workers with high contact jobs, healthcare workers, servers, people who are delivering things, they are putting themselves at risk just by doing their job to provide us with services. So you could at least return the favor and help do your best to protect them as well. Also, it prevents hospitals from being overwhelmed. I've talked about this already, and also mutations that cause the variants. So these are some things that I still do. I wear masks in crowded areas. Every time I go to a grocery store, I still wear a mask, and especially indoors and when traveling. I just recently flew on a plane, and I mean, there's still, it's still required that you wear a mask and everything. But even when I was in public spaces in different states, because different states have different mandates and restrictions and also vaccination rates, I just recommend when you're traveling to wear a mask as much as possible. Socially distance when possible, and also, especially now that it's getting cold in Ohio, at least, in different states like here in Massachusetts, it's going to start getting colder again, which means more indoor activities versus outdoors, which increases the chance for spread. Also, organize social pods and stagger visits between pods. This basically is just a concept that came around to talk about how it's important for you to find, because it's, completely isolating is very damaging as well, but find a group of people that you can still socialize with and that you trust that you're following restrictions and staying safe to protect each other. And then if you can stagger, if you're vaccinated, a few days or a week is probably fine. If there's people who are unvaccinated, 2 weeks between visits. Also avoid areas with outbreaks, obviously, and people who have been in contact with someone infected. And also, share this presentation or spread this information to encourage others to be vaccinated. I am definitely not about telling people what to do with their bodies, but when it comes to it being a public health crisis, and there's this clearly safe, objectively safe and effective way to prevent all of this from happening, I think now this is the time to be a little bit more vocal about it and really help spread the correct information so people can make the best decision for themselves and also for our community. So going into that, this is the most opinionated I'm ever going to be in one of these presentations I give, because I really do just try to provide the information for you. But based on everything, talking to the experts, my experience with things, looking at the research, it is just so clear that refusing to be vaccinated, if you are someone who can get vaccinated, is irresponsible. When you choose not to get the vaccine, you put yourself at risk for severe health complications. You encourage the spread of the virus, infect those who can't protect themselves, especially children and the immunocompromised, who I explained earlier, a lot of them can't even take the vaccine because it will actually kill them. You facilitate production of variants, which is, in my opinion, one of the biggest concerns right now, because if people keep refusing to get the vaccine, we're going to be back to square one, trying to get a new vaccine and redoing this all over again. Also, you overwhelm the hospitals, which is unfair to the healthcare workers and also can result in the death of people who it's not even from COVID-19. Also, you fuel lockdowns and extending the restrictions for everyone, which no one's happy about it. So it's really important that we all work together to actually tackle this issue. And if you qualify for a vaccine, please, please, please get it as soon as possible. And I think I really wanted to say this because I know a lot of people talk about, well, it's my right to choose and it's my individual choice, but taking all of this into consideration, your decision is no longer an individual choice when it affects everyone. And I hope with this presentation, I've really helped to show that viewpoint. So now I'm going to open it to questions from the audience. Sorry, I know this took a little bit longer than I was hoping, but there was a lot of information there and we did get a ton of questions from our social media. But you can always email me. I always offer the slide decks and everything are for public use. So you can email me if you want access to the slides. You can rewatch the recording of this on our YouTube channel, and then you can send us more questions about anything COVID related through our Facebook and our Instagram. So at this time, I'll open it up if anyone in the audience has questions. If not, I will stop the recording. Okay, so good. There are some in the chat. Thanks, Niraj. Is there a seemingly credible source which you have discovered to be untrustworthy? So I will say, most of the media outlets, I think I had mentioned earlier that even the mainstream media outlets who do their absolute best to report the science and the information correctly, because a lot of times the science can be extremely dense and difficult to interpret, you can have actual credible news sources that do get things slightly wrong. It just happens sometimes. I would say though, for some of the links that people have sent me, any website that has something to do with like independent thinker or objective truth or any sort of thing where they make it seem like it's unbiased, those sites almost always have a lot of bias in them. So that's why I kind of mentioned earlier, if they're pulling quotes from, experts or so-called experts, you can quickly type that person's name into Google Scholar or PubMed or ResearchGate and see how credible they actually are. So I hope that answered that question. And then another question, I have been fully vaccinated for months and I feel no symptoms. How often should I test myself? If you don't have any symptoms, there's just no need for you to actually get tested if you're vaccinated. You should maybe consider getting a booster. You can certainly get tested if you are having any sort of COVID-like symptoms. I actually know a couple people just recently who had fevers and colds, and they went and got tested. It was negative. For me, I actually had a terrible cold a couple months ago. Like it knocked me out for a week, but because of work, I have mandatory testing. So I came in just long enough to do my test, and it came back negative both times. But I think it's going to be a weird balance between, since we have been socially distancing and had been wearing masks for so long, we have to remember to be kind to our immune systems, because they haven't been used to being around people again and being outside and interacting with all these different things. So our immune systems are also just a little bit low to begin with. So we have to combat letting our immune systems come back in full force now that we're around other people and not wearing masks again. We have to kind of balance that with our sanity and, recognizing if it's COVID or not. But I would only get, if you're vaccinated, I would only get tested if you're demonstrating symptoms. And even then, honestly, if you have symptoms and you are like, you can isolate or quarantine and wait a couple of days, you're also probably fine too. Because for the standard person who's vaccinated, you're going to flush out that virus in a matter of days. And so I should say a person with a normally functioning immune system should be able to get rid of that virus within a couple of days. All right. Any other questions?
Hey, Emily, I have a question.
Great.
So I know somebody personally who is 65 years old who never got the vaccine. They tested positive for COVID 6 weeks ago in the hospital, on and off a ventilator for 3+ weeks. What are the chances of them surviving this at that point?
So you're telling me they're still in the hospital?
Yes.
Okay. So it's really, really hard to say. That would be, remember when I gave the table earlier and it was like, which expert should you ask at which time? That would actually be a better question for a medical doctor, because they will have actually seen, since I'm not at the bedside, I don't have a good idea of when they might get better versus when they might get worse. And also they're going to have seen a lot of patients who went through something like this similarly. So they're going to be a better person to ask for their educated opinion. What I can tell you from the research standpoint though, is because this attacks everyone so differently, we literally have no idea. And because there's no treatment, we also have no idea. So, I mean, there have been reports of people being in the hospital for several months who came out of it. Yeah, they've had to get limbs amputated and they have very severe long-term health complications, but they did survive. And then there have been some people who go in and they don't seem that bad when they initially are put on oxygen or something, and then they pass away within a matter of hours. So this virus really does attack people individually. And because we don't understand yet how it works or how COVID-19 develops, we don't have a way of estimating someone's survival.
Okay, thank you.
Yeah, sure. Any other questions? I think there's one more in the chat. Okay, great. If you're fully vaccinated, but then encounter a risky circumstance, such as close contact with a COVID positive person, become pregnant, attend a large indoor maskless gathering, should you feel remotely safe? Yes, you can definitely feel remotely safe, but this would actually be a good time. So for me, I still wear masks in indoor gatherings, and it's better if everyone is wearing a mask. But if you're wearing a mask, you're still probably doing okay, even if other people around you aren't wearing masks. I think that would be a good time then to consider getting tested. So for me, I actually feel a little bit better about attending events and traveling because I have the privilege of getting tested regularly at work. So I actually play in a trivia league every Tuesday, but I get my test results back before I go to that every day. And even then I only stay with my trivia group and don't really interact with anyone else. If you come into contact with a COVID positive person, you know for a fact that they have it, you should definitely quarantine and get tested. And I would recommend, if you're vaccinated, I would recommend getting tested as soon as you find out that you came into contact with them. And when you go get your test, please wear a mask and, wash your hands. Don't come into contact with anyone that you can avoid. Use hand sanitizer if you do, let them know. And that would be a time to get tested and quarantine. So get tested right away, but then also get tested. If that comes back negative, great. If it comes back positive, then you should definitely quarantine and do a follow-up test when you start feeling better. If the test comes back negative, you can be extra safe and get another test in like 3 or 4 days, because by then you will have known if the virus is building up in your body or not. But usually when the virus has started building up in your body, you get symptoms. So typically the people who have been infected and don't don't really spread it, or didn't need to get a test, or didn't really have symptoms, it's because their body was able to tackle the virus immediately. So again, like that virus buildup is really the determinant for how sick you're going to get, how contagious you're going to be. So the PCR test will help you determine how much of that virus is in your body. And if you test negative twice within a matter of, spread out from 4 days, you're probably fine. But yeah, either way, if you come into contact with a COVID positive person, you definitely should quarantine for at least a few days until you can get your testing done. Okay, great questions. So thank you everyone who attended, and also thank you so much to everyone who submitted questions in advance. I actually learned a good amount too, especially from my friends who specialize in public health policy. And so it was fun to research. But please get your vaccine, and please reach out if you have further concerns. I'm more than happy to provide information to help people make the best choice for themselves. So thank you. And this recording will be available via our YouTube. So please share the link with other people who might be interested.